orthodontic braces, basically, straightening out children's teeth and perhaps even adults' teeth. So, Dr. Stein, are you doing any type of orthodontic work?
Yes, I do Invisalign and ClearCorrect, which are both the two companies that have it's orthodontic treatment but without wires. It's a clear appliance that's Invisalign. You replace it every 2 weeks. With ClearCorrect, it's every 3 weeks. But the mechanism is similar. It's that you apply pressure to the teeth by replacing the aligners, which are clear plastic trays, rather than putting in wires. And that's how teeth are. Usually takes about 6 months to a year of treatment, and then that's how we move the teeth.
I see. So it's basically like a mouth guard, roughly said, right?
Right. And, yes, it's very similar to a mouth guard.
Right. So it's like a mouth guard, and these things are called. They're made out of some type of plastic or whatever it might be, right? And yes. This thing are called Invisalign. Well, let me ask you, Dr. Stein, are they really invisible?
They are. They really blend in, and they're really not visible. You the patient, you really don't see them.
Wow. Tell me, is there a case where an Invisalign just wouldn't work, and you need to go back to the more standard or braces of wires and stuff like that?
I'm sorry, I didn't quite hear you.
Are there cases where the teeth are in any shape and form crooked or whatever it might be, that an Invisalign wouldn't do the job, and you have no choice but putting on braces? Does that exist?
Yes. Invisalign is not intended for every case. It's intended more for simpler cases. There are cases that need a combination of Invisalign plus wires, and there are cases that need the old-fashioned wires, but it's not intended for every case. I'm a general dentist. I treat some cases, but when I see cases where there's very severe crowding and teeth that will have to be extracted, that's a case for an orthodontist. And it's not, we can help some. We can do many cases, but there are cases that need to be done by specialists that do only orthodontic treatment.
I got it. But obviously a mom or dad bringing in his or her children, or for that much himself, you would know when you go, that's definitely can be done with Invisalign, and it's wonderful. Or like, I think you need some really heavy pulling with the wires. You would know that, right?
In most cases, we can tell. There are some cases where there may be a question, and then we can always submit, and a case can be evaluated and before treatment is done. But most of the time, we can tell if a case can be done in our office or needs to be done with more traditional orthodontics.
Right. Now let me tell you, this Invisalign things. Are there less or more? Is it for the patient? Is it easier to comply with it, or does he have to spend more time in the dental office or less time with Invisalign versus regular braces?
For the most part, I would say it's easier because it's easier eating with it. There are no wires. It's easier to clean. You can remove the plastic, the container. So in terms of keeping it clean, it's easier. A disadvantage would be, I would say, for a child. I prefer to do it more for adults or for older children, because the fear that I would have with it would be for a younger child is that they may lose it. So the advantage can also be a disadvantage in certain cases. I wouldn't recommend it for a young child because it gets expensive. If the aligner is lost, they have to replace it, and then that defeats the purpose. So for a young child, I would prefer to have the metal wires. That way they're not going to lose it. It's bonded to their teeth. But for an older person who is responsible, or an older child who wants the appearance of not having wires on their teeth and to be able to clean better, then then Invisalign works very well in most cases.
Wonderful. And the reason that a person might lose it because in the first place he's taking it out every time he eats, right?
Right. That's true.
Which has the advantage that after that he or she can brush and floss like normally, right?
Right. That's.
And the spinach doesn't get caught up in the wires.
Right. Exactly.
Yes. Because again, we talked about gum disease quite extensively and how bad that actually affects your whole. Body or immune system and everything. So if a child is wearing a year and a half or 2 years those wires, if he's a little bit on the slappy side and doesn't brush and floss, because it must be harder to floss and brush when you have braces on it than with normal teeth, right?
Yes, it is harder, yes. And that is a very important, even part for proper movement of teeth, it is important that the gums stay healthy. If the gums are irritated, if they're bleeding, it actually slows down the movement of the teeth, and it can cause gum problems and bone loss, and which is what we don't want to have during treatment. So that's definitely an advantage of Invisalign, that you can. It's much easier to keep clean.
Wonderful. Looks like a whole bunch of advantages if, based on the dentist's evaluation, a person is, as you might call it, a candidate for it. All right. Well, good. Wonderful. Thanks a lot for filling us in on Invisalign. And, it definitely looks like you do an array of work there in your practice. You just basically do just about anything, right?
Yeah, pretty much. Most treatments, yes.
So it's a one-stop practice. The moms can bring in their children, and they can bring in their teenager for adjustment for the ortho. They can get their own orthodontics, and of course they get their veneers, the crowns, the implants, and all that type of stuff. Dentistry has advanced quite heavy, and it's amazing actually. One may not think that technology, how much technology has impacted even dentistry. Yeah.
Right. Yes. Yeah, definitely.
Well, Dr. Stein, thank you very much for letting us know about Invisaligns and about
thank you.
ortho.